Hi, I'm Dr. Nasseri, and I'm a founding partner of the Surgery Group of Los Angeles. I'm also double board certified in both general and colorectal surgery. March is Colorectal Cancer Awareness Month, and I wanted to talk to you about this very important topic and what steps need to be taken to prevent and combat this disease. So colon cancer is essentially the cancer of the large intestine, which is the last part of the digestive system. It normally starts with a cluster of cells, polyps, which are benign, and over time progresses to cancer. There is approximately 140,000 cases of colorectal cancer in the United States, and of those, approximately 50,000 deaths. Risk factors for colorectal cancer include age, older age, family history, but also include sedentary lifestyle, consumption of high-fat or red meat diet, and low consumption of fiber. Other risk factors include people who have inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. While there has been an overall decrease in the incidence of colorectal cancer, there has been a steady increase in the rate of cancer in the younger population. Those are patients between the ages of 20 to approximately 45 or so. The most common symptom of colorectal cancer is change in bowel habits. That could manifest itself in change in either consistency or the caliber of the bowel movement. Other symptoms of colorectal cancer include bleeding, persistent abdominal or rectal pain, and weight loss. But do not forget that many times colorectal cancer is diagnosed in patients who undergo routine colonoscopy who do not have any symptoms. Colon cancer is most commonly diagnosed with colonoscopy. In fact, colonoscopy is the most accurate test, not just to diagnose colon cancer, but the pre-malignant polyps that come before cancer, and also gives vital information about the location of the cancer and allows for biopsies. While pre-malignant polyps can be managed endoscopically, the vast majority of colorectal cancer requires an operation. Fortunately, nowadays, we're able to operate using minimally invasive techniques. And more recently, we use robotic surgery to allow for a quicker recovery, a more accurate operation, and ultimate quicker return to daily routine and lifestyle. By far, the most effective way to prevent colorectal cancer is by getting colonoscopy. Colonoscopy allows for identification and removal of pre-malignant lesions known as polyps. Other things can be done in one's lifestyle to also prevent cancer. Those include decrease in amount of consumption of fatty food and of red meat, increasing fiber in one's diet, increasing activity. I recommend approximately 20 minutes of exercise 3 to 4 days a week, and decreasing consumption of alcohol and smoking of cigarettes. For several decades, the recommended age for colonoscopy has been 50. Recently, we lowered the recommendation to the age of 45, and I abide by those new recommendations to have patients start at an earlier age, as we've seen rise in the incidence of cancer in younger patients. Thereafter, it depends on what is found on the initial colonoscopy. But a general rule would be to get a colonoscopy anywhere between 5 to 10 years going forward. As you can see, colorectal cancer is a very serious and potentially life-threatening disease. It affects people young and old. Fortunately, it can be prevented, and if diagnosed early, it can be successfully managed and even cured. For any questions about colorectal cancer or anything else you've heard in this video, or to schedule a screening colonoscopy, please call my office. Thank you again for watching, and see you soon.